Hello students, today we'll discuss one more important topic, that is the anatomy of the spleen. This is Dr. Yusuf signing from Al Jof University. With regards to this topic, the specific objectives which we'll try to cover are describe the spleen with regards to its position, the shape, borders, surfaces, peritoneal coverings, as well as the attached ligaments. The second one is mention the relations of the visceral as well as the diaphragmatic surfaces of the spleen. The third is name the structures which are attached or passing through the hilum of the spleen. The fourth is mention the vascular supply of the spleen and identify the segmentation of the spleen. And the fifth is mention the development of the spleen. So these are some of the specific objectives which we'll try to cover in this topic. As you know, the spleen is a very important hemopoietic organ which is present in the body. The synonym for this spleen is, in case of Latin, it is called as lean, as you can remember the lino-renal ligament. So it is lino means the spleen, and in case of Greek it is called as spleen. With regards to its description, as I said, it is one of the very important hemopoietic hemolymphatic organ, which is said to be the largest single mass. If not, the lymphatic is spread throughout the body, and it is in the form of nodules, or in case of lymph nodes or something else, and it is widely distributed throughout the body, especially in case of GIT and other parts. But as a single mass, this is the largest single mass of hemolymphatic organ in the body, and it belongs to the reticuloendothelial system. With regards to its location, it is present in the left hypochondrium. As you know, the abdomen is divided into 9 quadrants, and if you can see here, the spleen, and this part is called as the left hypochondrium. On the other side we have the right hypochondrium, and in the center we have the epigastrium. So mainly it is present in the left hypochondrium, but a part of it might even enter slightly into the epigastrium. And if you see the position of the spleen, it is wedged between the fundus of the stomach. This is the stomach here, and the diaphragm on the other side. So it is wedged between the stomach as well as the diaphragm, and it is in between them. This is the spleen here, okay, which is caught between the stomach as well as the diaphragm. Regarding its shape, it is almost wedge shape or tetrahedral in shape. With regards to its size and weight, there is a dictum called as Harris dictum, which is 1, 3, 5, 7, 9 and 11. So it is in the form of 1, 3, 5, 7, 9 and 11. So in this form you can easily remember its height, weight, length, breadth, everything. So this is called as Harris dictum. So what is 1? 1 is the thickness of this spleen. It is 1 inch thick. Okay, when you hold it between your 2 fingers, it will be thickness of almost 1 inch at the most thickest part, which is near the hilum. Then it is 3 inches in breadth. So this is the breadth. So it is almost 3 inches, and the length is 5 inches. So 5 into 3 into 1 is the total size of this spleen. Okay, so 1 inch in thickness, 3 inches in breadth, and 5 inches in length. So length is here like this. Okay, and the weight of this spleen is almost 7 ounces. 7 ounces, and it is caught between the 2 ribs, 9th and the 11th rib. It is between the 2 ribs. Okay, between the on the left side, because it is present on the left side, only on the left side. So it will be between the 9th and 11th rib of the left side. With regards to its axis, because it is between the 9th and 11th rib, so it is actually below the 10th rib, and the long axis of this spleen is with regards to the 10th rib. So it is in the same line as that of the 10th rib. So it lies obliquely along the long axis of the 10th rib and makes an angle of 45 degrees with the horizontal. So as the rib is present at an angle of 45 degree, as you know, the ribs are coming from behind. Okay, the head and neck of the ribs are behind and they don't reach up to the sternum, the 9th, 10th and the 11th rib. So they all come in this angle and they go up to the sides. So in with regards to that, this spleen is present between the 9th and 11th rib, and it is in the same axis as that of the 10th rib, and hence it is in the 45-degree angle, so it is directed downwards, forwards as well as laterally. Okay, here it is shown vertical, but it is not exactly vertical, it is in this fashion. So it is almost obliquely placed at an angle of 45-degree, and it is directing downwards, forwards as well as laterally. With regards to its external features, it's a soft, highly vascular as well as dark purple in color. So it is highly vascular organ because lot of blood will be entering into this through the splenic artery, and here, as you know, it is one of the very important hemopoietic organ. So here the breaking down of the RBCs will be taking place, so that's why it is highly vascular as well as dark purple in color. This is almost the color of the spleen. Coming to its parts, it has two ends, anterior and posterior end. Anterior end is in the front, it is almost broad, so this is called as the anterior end or extremity, and the posterior end is behind, which is that backwards and upwards. So this is the normal position of the spleen. This is how it is seen, okay, on the left side. So this is the posterior and this will be the anterior end. Okay, in the bracket I have also mentioned, because the anterior end is more on the lateral side and the medial end, the posterior end is more on the medial side, and it is directed by backwards. Coming to the borders, there are three borders. One is the superior border, this is the superior border here, and there is one inferior border here. This is the inferior border, this is the superior border, and then we have, this is called as the intermediate border. This is the intermediate border where the hilum is present. Okay, this is the hilum. Hilum is that part where the structures either will be entering the spleen or they are coming out of the spleen. Okay, so you can see a lot of structures which are entering or coming out. Okay, this is called as the intermediate border. Then we have the superior border and the inferior border. How do you identify the superior border? With the presence of notches here. So you can see the notches here. These notches are because the spleen during development, it is in the form of nodules which later fuse together, and their remnants are still present in the form of notches in the superior border. So this is how you can easily trace the spleen. Whenever there is splenomegaly, at that time, whenever you feel, this is the border which will be enlarged to a large extent, and it will be entering into the other quadrants of the abdomen. And whenever you palpate, you feel the border of the spleen, and if you feel the notches, then you can easily identify this is the spleen, and this is the anterior border of the spleen, which is showing notches. Okay, so you can easily differentiate between the splenomegaly and with that of any other organ which is enlarged in the body within the abdomen. Okay, so these are the three borders, two ends, anterior end and the posterior end, three borders, superior border, inferior border and the intermediate border. Then two surfaces, there are two surfaces. One is the diaphragmatic surface, and then this is called as the visceral surface. Diaphragmatic surface is that surface where it is in contact with the dome of the diaphragm here. Okay, so it is smooth because only diaphragm is present, so it is smooth as well as it is in contact with the diaphragm. And the other surface where it is in contact with the other organ, this is called as the visceral surface. Okay, so this is the visceral surface where we have the structures which are in contact. So as I said, the relations of the spleen, on one surface it is the diaphragmatic surface where it is in contact only with the dome of the diaphragm and it is soft, smooth. Okay, so here it is the diaphragmatic surface, and the other surface where it is in contact with the other organ, that is called as the visceral surface. So there are four important impressions or four important structures which are in relation to the visceral surface of the spleen. The first one is the fundus of the stomach. You already seen the picture before. So if you see here, this is the stomach, and this is the fundus of the stomach, which is in contact with the spleen here. So this is a very important relation which is present on the vessel surface, the fundus of the spleen, which is in particularly near the between the superior border as well as the intermediate border. So this surface, this is called as the gastric impression, or the impression of the stomach. Okay, so that is the area where the stomach will be, especially the fundus of the stomach, will be in contact with the spleen. The second important relation is the anterior surface of the left kidney. If you can see here, this is the kidney here, this is the left kidney, so which is in contact with the spleen. Because the kidney is retroperitoneal, so the anterior surface of the kidney will be in relation to the spleen here. Okay, so this is the area where this is called as the renal impression, where the anterior surface of the kidney will be in relation to the spleen. The third important relation of the visceral surface of the spleen is the splenic flexure of the colon. So if you can see here, this is the transverse colon cut, and this is the descending colon. In between, there is this flexure is called as splenic flexure, because it is very in close relation to the spleen. So that is called as the splenic flexure of the colon. Flexure means the bending. Okay, bend. Okay, so here it is in relation, this is the area where the splenic flexure of the colon is in relation to the spleen. So this is called as the colic impression. So there is important gastric impression, then the renal impression, and the colic impression. The last but not the least, which is actually very important relation, is the tail of the pancreas. The tail of the pancreas is in relation to the hilum of the spleen itself here. Okay, so this is the fourth important relation, which is the tail of the pancreas. So there are four important relations. On the top we have the gastric impression, which is in relation to the fundus of the stomach. Then we have the renal impression, where the left kidney is in relation to the spleen, and here below we have the spleen flexure of the colon, which is in relation, and the most important will be the tail of the pancreas, which is in the near the hilum of the spleen. Coming to the peritoneal relations, because all these organs which are surrounding the kidney, surrounding the spleen, or in relation, are covered with the peritoneum. So even the extension of this peritoneum from those organs will be extending into the spleen, or over the spleen. Okay, spleen is surrounded on all sides by the peritoneum and is suspended by the following ligaments. So it is covered totally by the ligaments which are extending, or the peritoneal folds which are extending from different organs which are in relation. So which are the folds which are in relation with the spleen? One is the gastrosplenic ligament, the extension of the spleen from the fundus of the stomach. We have seen that the fundus of the stomach is in relation to the spleen. Okay, so that same fold of peritoneum which is covering the spleen, the stomach will be covering partly even the spleen also. That part is called as the gastrosplenic ligament, which is between the stomach and the spleen. So it's called as gastrosplenic. The second is called as lino-renal ligament. The most important is the lino-renal ligament. Lino means, as I said before, lean means the spleen, and renal means the kidney. So as we have seen already, the kidney is in relation to the spleen. So there will be a fold of peritoneum covering the kidney and the spleen. So that is called as the lino-renal. The third is called as the phrenico-colic ligament. There is a fold of peritoneum which is extending from the diaphragm. Phrenico means diaphragm, to the colic flexure of the colon, covering even the spleen itself. So this is called as the phrenico-colic ligament. So these are the three ligaments which are actually covering the spleen, which are holding the spleen in its position. Among those, the most important, as I said, is the lino-renal ligament. Why it is so? Because the lino-renal ligament contains the tail of the pancreas as well as the splenic vessels. Very important relation is the presence of the tail of the pancreas within the lino-renal ligament. If you go back to this picture again, if you can see here, this is the tail of the pancreas. This is the pancreas, the whole thing. This is the head, this is the uncinate process, neck, body, as well as the tail. Tail extends up to the the hilum of the spleen. As I said, the important relation is the at the hilum of the spleen is the tail of the pancreas. So it is within the fold of the lieno-renal ligament. This is very important, especially when you are doing the splenectomy. In case of the rupture of the spleen or splenomegaly, at that time when you are cutting the spleen and removing it, at that time you have to cut even the lieno-renal ligament. When you are cutting the lieno-renal ligament, within that will be the tail of the pancreas. So what's the importance of the tail of the pancreas? The tail of the pancreas has islets of Langerhans, the major quantity of islets of Langerhans, which will be secreting the insulin, will be present in the tail of the pancreas. So when you're cutting the lieno-renal ligament, if you're not careful, you can cut the tail of the pancreas itself, and that leads to a condition called as induced diabetes. So that's why the tail of the pancreas, which is within the lieno-renal ligament, is a very important relation with that of the spleen. Did you get it? Okay. Now going to the arterial supply. The main artery which is supplying the spleen will be called as the splenic artery. It is a very tortuous artery which is coming from the celiac trunk. So a very important artery which is over the upper border of the pancreas. This is the pancreas here, this is the tail of the pancreas which is in relation to the hilum of the spleen, and this is a very tortuous artery. This is called as the splenic artery. And this, as I said, along with the tail of the pancreas, this splenic artery also passes through the lieno-renal ligament, and it reaches the hilum of the spleen, and before it enters the hilum, it divides into 5 or more branches. So here you can see 5 branches. It is divided into 5 branches, and then it goes and enters and supplies the pancreas. This is dividing into multiple branches because, as I said, it is initially developed as a lobulated form which later fused together. So these are supplying the different lobes of the spleen itself. So these are some of the important structures which are at the hilum of the spleen. One is the tail of the pancreas, then the splenic artery, then the main vein which is draining the spleen, that is the splenic vein. So the venous drainage of the spleen is by a vein called as the splenic vein, which is also on the superior border of the pancreas. So this splenic vein starts draining the spleen, and it is joined by the inferior mesenteric vein, and it continues beyond and joins with the superior mesenteric vein to form the portal vein. So the splenic vein will finally drain into the portal vein. Okay, so this is the venous drainage of the spleen, and the nerve supply is by the sympathetic fibers which are coming from the celiac plexus, and they are vasomotor in function. A brief note on the development is the spleen develops in the 6th week of the intrauterine life, and it is from the dorsal mesogastrium, especially the cephalic part of the dorsal mesogastrium, and from the left layer. Okay, so for the details, whenever we discuss about the development of spleen itself, there we'll try to cover, and it has also been covered during the development of the initial development of the human embryo. Initially, as I said, it will develop in the form of number of nodules or lobes, and later they all fuse together. Hence, as I said, you can see this notching of the superior border is because of the fusing of the incomplete fusion of the nodules of the spleen. Sometimes these nodules don't fuse together, and those are called as accessory spleen, or they are also called as the spleniculi. Okay, it appears when the splenic nodules fails to consolidate in the embryo. Sometimes they don't fuse together, or sometimes most of it has been fused but a few remnants might remain behind. Okay, and they might be seen especially in the broad ligament of the uterus, spermatic cord, as well as the gastrosplenic ligament. Here we have shown the gastrosplenic ligament where there is the accessory spleen, as well as the linorenal ligament. This is the linorenal ligament where the tail of pancreas as well as the where we have seen the broad ligament of the uterus, you can see this as a spleen in case of the broad ligament of uterus, spermatic cord, gastrosplenic ligament, linorenal ligament, gastrophonic ligament, as well as the greater omentum. So this is about the spleen, and if you have any doubts you can definitely write to me and I will try to answer. These are the references. Thank you very much. If you like this video, just click on the like button, and if you want to see more such kind of videos, you can definitely subscribe to my channel. And if you want to get regular updates, just subscribe my channel and you will get the regular updates. Thank you very much.